Hi, I'm Dr. Johnny. Thanks for joining me today for Raji's Quick Clip. What is Sculptra? I talk about it a lot with Plasmasculpt with my video Look 10 Years Younger, where we do top to bottom, full face, non-surgical facelift if you want to call it that. And Sculptra is a component. It's PLLA. What is it? We're going to dive in a very Raji's Quick Clip, 3 seconds. Hang on. Okay, so remember to like the video and subscribe. This is a quick clip. What is Sculptra? Sculptra is PLLA, poly-L-lactic acid. For those of you who like threads and PDO threads, there are PLLA threads. The beauty of Sculptra is it comes in a water. That means you can blanket areas. And when you watch that video, Look 10 Years Younger, you'll see me address the temple, the cheek, the under eye, the area in front of the ear, the whole lower face, and the jawline. Why is it I can do that with Sculptra combined with platelet-rich fibrin? Because I can blanket the areas. If you go in and get a gel filler, it would break the bank. There's no way you can cover all that. And of course, adding PRF, we can do the brow and you get a bit of hair growth. The brow is an important part. It frames the eye. The eye is important. We need the under eye. You don't put Sculptra there, but you can put PRF. That's why Sculptra is kind of an art to do. There's things you shouldn't do with it. What does it break down to? What is it? It goes in as a liquid. It's 50 microns in size. It's a small particle. Think about fertilizer for the face, if you will. It goes in, you build collagen around it. Now, that collagen that you build is yours to keep for a long time. The studies were stopped at 2 years. At 2 years, 80% of people still saw a very good result. The graph went straight across. It didn't dive down like normally with, the 6 months fillers for hyaluronic acid, the collagen that was lasting 8-12 weeks. This is a long-term product. Now you'll ask, how long is it in the body? Great question. PLLA, so 50 microns, back to that super quick. When you take a pen and you drop it on a piece of paper, and you barely see the blue or black dot from the pen, that's about 50 microns. That's the size of the particle that's going in the face. Build collagen around that. That's going to be long-term and it will last you. That particle itself can be found in the body for up to 22-23 months is around the maximum. Mostly it's gone by 4 to 6 months, and then you get to keep that long-term collagen. What happens to that particle? That particle is metabolized essentially into carbon dioxide and water. So it's a very natural process in that sense. So that's Sculptra, very different from the gel fillers like hyaluronic acid. It's a biostimulator. The other two biostimulators that most people know of are something like Belafil, which is PMMA, as opposed to Sculptra, PLLA, poly-L-lactic acid, and Belafil is polymethyl methacrylic acid, PMMA. And then of course we have Radius, which is carboxymethyl cellulose, 70% of the syringe, and 30% is calcium hydroxylapatite. And the calcium part stimulates collagen as well. So biostimulators build your collagen, the fillers contour. So a lot of people wonder what they should get done. A lot of times it's both. Sculptra will contour. You have to be patient, but it won't be as crisp as a border as, say, calcium or your hyaluronic acid fillers. I know it's complex. The most important thing you can do is find a good provider, sit down in front of him or her and say, what should I do? And then have a conversation based on educating yourself by reading, by looking at these videos, and by whatever your provider gives you for education on the procedures. That's Sculptra. Let me know in the comments, what else do you need to know? What are your questions? And do you like Sculptra? Have you had it done? Stay tuned with me here on this channel. Keep your skin and body beautiful, healthy, and vibrant.